Hi, I haven't made a video for a while, but just recently some Official Information Act material came into my hands, and it's from the Southland District Health Board, or the Southland Hospitals. It comes in two parts. The initial part has a LOS column, which is length of stay column, which I found quite interesting. So I'll look at that first, and then I'll get into the more detailed information. And you can see the first response here. It's mostly to do with the vaccinated people in the first response. The second response also includes non-vaccinated people. But this first response has got a LOS column up here, which is interesting. So I thought it would be good to run through some of the results from that to start with. So let's get into it. And this is the first graph here. This is the under 30-year-olds vaccination. Most of this age group are vaccinated. One or two weren't, so I think about 9%. The green graph is the vaccination status on arrival at the hospital. The blue graph is the length of stay when in hospital, and you can see there's a bit of a peak there in July this year. And the grey line is the hospital admission numbers, and as pretty much all of them are vaccinated, they're called vaccinated hospital admissions here. So you can see that there's been a steady rise, and if you go to a trend line, you can see there's been a steady rise in the number of admissions and the length of stay over the year for this age group. So let's have a look and compare it with the vaccination, just out of curiosity. This is the vaccination rate for the same age group, and as you can see, there's a very similar trend line here for under 30-year-olds. So let's move to the next age group. This is the 30 to 59-year-old age group, and from this point onwards, all the age groups have been 3 or more vaccinated. So these are the 3 or 4, or in some cases 5 vaccinated people. And you can see in grey again is the hospital admissions, and the brown is the COVID vaccinations on arrival, and the blue is the length of hospital stay. And again, you can see a slight trend increase over the period from January to September this year. The past vaccination rate is much steeper than the trend line here. But it seems like when 30 to 59-year-olds go to a hospital, it's pretty stable. Across the year, it's pretty flat. And the past vaccination rates don't seem to affect the length of stay or the number of admissions during this year. And we'll go to the next age group now, the 60 to 79-year-old age group. And you can see there's a steady trend from January to September over the year for this age group. And if you look at the vaccination rates, it's quite similar. The past vaccination rate is slightly steeper, I guess, but there's maybe a correlation between the length of stay in hospital and the vaccination rates for the 60 to 79-year-olds. If we go to the 80 and over age group, there's a slight increase again from January to September for the length of stay in hospital. And if we look at the vaccination rate, it's very similar, a slight increase in past vaccination rates from the beginning of the year to the end of the year. So there may be overall correlation between vaccination and length of stay in hospital. So we now go to the second lot of data provided by this Official Information Act request. And this data is much more comprehensive, and let's have a look at it. But before I go any further, I just want to quickly allude to this graph, which shows that 16% of New Zealanders are not vaccinated and 84% are. This is a graph put up by the Ministry of Health and passed on to Radio New Zealand, and it's on their website today at their address down the bottom. And it pertains to the results that are coming up, but I'm just referring to it now. We'll start off, we're going to the 0 to 9-year-old age group. And you can see that there have been a much larger number of non-dosed in hospital from January to September in the Southland District Health Board hospitals. And the reason for this 0 to 9-year-olds difference I'll get to shortly. The 10 to 19-year-olds, there are more double-dosed people in hospital than non-dosed, but the lowest number is the one-dosed people. It seems maybe the effect of the vaccine may have worn off some time ago, who knows. Go to the 20 to 29-year-old age group, you can see that the second dosed and the third dosed people are in hospital more than the non-dosed or the one-dosed. And you can see down bottom here, the 4 dose are just starting to come in, and they seem to be doing okay as well. But the second and third dosed patients don't seem to be doing that well. In the 30 to 39-year-old age group, again, the second and third dosed in the purple and the green are not doing that great. The non-dosed and the one-dosed and the fourth dosed are doing better. 40 to 49 year old, again the third and fourth dose aren't doing too well. The non-dosed, one dosed and fourth dosed are doing better also, although I noticed that the fourth dose down the bottom is starting to rise a little bit in this age group. If we go to the 50 to 59 age group, again the 3-dosed and the 2-dosed aren't doing that well, whereas the non-dosed, 1-dosed and 4-dosed are doing better, except down here in September, where there's been a bit of a crossover. The fourth dose is just starting to appear above the other groups, although it's too close to count really. It's a marginally difference at this stage. That's the 50 to 59. In the 60 to 69, we're seeing a pattern develop in the older age group. I would call it a Chinese cookie shape here. And you can see over here on the left that the 3-dose are overtaking the 2-dose who are dropped off, maybe as the effects wane in the 2-dose, but the negative effects are increasing the 3-dose. And then you can see over here in September, the 3-dose are dropping off, where the 4th dose are actually coming up. And there does seem to be maybe a benefit over here in January, February for the 4th dose, but it's waning through the middle of the year, and at the end of the year, it's actually turning into a negative effect, which must be of great concern to officials, at least it should be. 70 to 79 year old, again, we've got this purse shape or this Chinese cookie shape graph where there's been a crossover here early in the year between the 3rd and 2 dose, and at the other end of the year the 3rd dose are dropping off, whereas the 4th dose are coming up and having a negative effect. And it seems like through most of this year the 3 dose have not done well in hospital in this senior age group. We go now to the 80 to 89 year old, the same purse shape or the Chinese cookie shape. Again, the crossover here early in the year, and again the crossover here in the later in the year, whereas the 4th dose are taking over the 3rd dose as far as hospitalizations go. And then we've got the 90 and above year olds, and whereas there are fewer people in hospital, the shape is still much the same. A crossover in January between the 3rd and 2nd dose, and again another crossover here in September between the 3rd and 4th dose. And it looks like the 4th dose are in for some bad times in hospital in coming months. We're going to now look at the rates per 100,000. And so if we look at the 0 to 9 year olds, you can see, we'll take away the first graph, we can see that the numbers of children in hospital who are not dosed are far higher than the number who are dosed. And on the first blush, it looks like the vaccines are doing very well for the young children. That's the 0 to 9 year olds. But these graphs were worked out for the 16% as before, as the non-dosed. But in actual fact, we know that the dosed is closer to 50% for children. In actual fact, the non-dosed is 51% for 0 to 9 year olds. And so therefore, the non-dosed rate comes way down. But it's still significantly higher than the vaccinated, about 300, I suppose, per month over the year. And the question is, why does this happen at this age group? And there are a number of reasons that can be presented. There have been a surge in RSV sicknesses over this year and previous year as well. And there's been a surge also in childhood fevers and coughs, influenza type sicknesses. And this is quite separate from COVID. And so therefore it does seem like a lot of non-vaccinated people have been in hospital for a lot of reasons and not directly related to COVID. And to back this up, we've got this graph here that just came out yesterday. It shows the coughs and flus over the years in red here. And you can see there's been a surge in the last month. And also there has been a surge of COVID in the last month as well. And I guess they're not unrelated. But you can see there's been a lot of sickness right through the year, and the reds have been right up there with 2019. And uncommonly it's going up during summer, which we don't normally see. And again, that must be concerning officials. But if we look at young people here in green, you can see the less than 5s have been having a bit of a hard time this year, with the under 5s rates being quite high, significantly higher than the other age groups, and even the 5 to 17s have been quite high as well. And that helps to explain why there are more non-vaccinated 0 to 9 year olds in hospital in Southland than other age groups, as we'll see in a minute. So let's move on to the 10 to 19 year olds, and these are the graphs for the all dosed, and then we add in into per 100,000, take away the other graphs, and you can see that they are closer. And again, there's a lot of childhood sickness, which might explain why they are a bit higher than the dosed in hospital for this age group. There are a lot of factors to consider for the child age groups and why this might be the case. Moving on to 20 to 29 year old, those are the all dosed figures. And then if we take away the all dosed and put the dose per 100,000, you can see that for this age group, the doses are very similar. All dose per 100,000 in green, where the non-dose in brown, and they track very similar. Going to the next age group, 30 to 39, big difference in doses in raw numbers. But again, if you take away that graph and put another graph per 100,000, again, very similar, and which is encouraging that the non-dose are not doing any worse than the dosed and vice versa. But when we get to the older age group, a trend does present itself. In the 50 to 59 age group, and there's all dose, and you see that there are a lot more dosed in hospital than non-dosed. But then if we take away that graph and put the other graph per 100,000, you can again see that they come down to be quite similar, although in this case, the all dose are doing a bit worse than the non-dose. The not dose are about 100 per month. The all dose are about 150-ish, maybe more per month. So the all dose do seem to be doing a bit worse than the not dosed. Moving up an age group, again, a big difference in the raw numbers. Take those away and put in the 100,000 numbers, and you see again an increasing difference between the dosed and not dosed. The not dosed are doing a bit better, quite a bit better actually, I think, than the all dosed. Again, going to the next age group, big difference in the raw numbers. Take them away and put in the 100,000 figures, and you can see that the gap has increased a bit more. And as you get older, the dosed people are going to hospital more than the not dosed people, and quite a lot more. Here we got a difference between, say, 50 per month to about 250 a month. About 200 people more per month in the 70 to 79-year-old age group are in a hospital. We'll go up another age group, again, big difference in the raw numbers. Take those away and put in the 100,000 per 100,000 figures, so we're comparing apples with apples, so to speak. Again, the difference is increased again, about 200 per month in the all dosed, and about, again, 50 per month in the not dosed. About 200, about the same actual fact as the last group. We'll go up to again to the last group, which is the 90 and above. A big difference in the raw numbers. Take them away and replace it with the per 100,000 figures, and you can see a significant difference between the two age groups. Less numbers here, probably about 15 to 20 per month in the not dosed, and about 50 per month in the dosed. At least double, maybe in some cases triple, the number of not dosed people if you are dosed in the senior age group. And just finally, I just want to talk about the comparison of the percentage vaxxed or not vaxxed from the Ministry of Health. You remember this graph earlier on where we saw that the Ministry of Health thought there were 84% who were vaxxed at least once and 16% who were not vaxxed. But if we go back to this graph here, the red dotted line here infers that there's about 90% of New Zealanders who are vaxxed, and yet the other graph showed there was 84%. So there's an inconsistency here in the Ministry of Health's own data. Now over here on the right, I've just estimated the differences for each age group. So there's about 6% more than the 90% who are vaxxed according to Ministry of Health. So those earlier graphs, you can take them down a little bit for the senior age group, but I think the lessons are still the same, that the senior vaxxed are not doing as well as the non-vaxxed, or the senior vaxxed are not doing nearly as well as the non-vaxxed, even though you could take 6% off it. In the middle is about 2%, which is marginal. It's about the same, I guess. And at the younger age, it's about a 2% the other way, a little bit worse. And as I've already explained, down here, there was a 51% non-vaxxed group for youth, which is around 49% vaccinated in some way. In my opinion, the Ministry of Health does need to get their act together and bring all their graphs in to reflect this true figure of the difference between vaccinated and non-vaccinated here in New Zealand. So there's a bit of interesting data from the Ministry of Health about the Southland hospital rates, which do show that at least the senior vaxxed are doing significantly worse than the non-vaxxed. In the 50 to 59 age group, still worse off to a lesser degree as well. So that information shows that for Southland hospitals at least, and probably for all New Zealand hospitals, the vaxxed are definitely worse off than the non-vaxxed, despite what the government continues to tell us. Particularly the third and fourth and now the fifth dosed vaccinated. I hope you appreciate this video, and we'll see you next time. Bye.